good afternoon. I'm doing syrup dressing change today. Alright, so I'm already coming to the room. I already see that the patient is safe, the room is safe. I already adjusted the level of the bed already. So I'm gonna go into I wash my hands already, and I'm just gonna go to the patient and talk to the patient. Hi, Mrs. Jones, good afternoon. My name is Bola. I'm one of the nursing students. I'm gonna do your central line dressing today. Is that okay? Alrighty. So I'm gonna verify your first name. Can you verify your first name, last name, and birth date for me? Alright. It matches with what is in my list here. Alright. So I'm gonna go and look at the order. The order says central line dressing every Wednesday. So today's Wednesday, so I'm getting your central line dressing change. Okay? Alright. I'm gonna sit that right there, and then so what I need you to do right now is it's gonna be a little discomfort. It might not be, but just so you know. So I'm gonna go ahead and change the dressing, and just please follow my lead, okay? Alright. So I'm gonna put my gloves on. I'm gonna wash my hands again. Okay. And I'm gonna go in the patient's mirror and just make sure I'm seeing. Alright, okay. Alright, so now I'm gonna put my gloves on. And I am going to just take out the whole dressing. While I'm doing that, I'm gonna go ahead and assess this side to see if there's any redness, any swelling, any tenderness, so that I can report that in my note. All right. Okay, so I'm gonna remove the dressing right away. Alrighty. Okay, so I'm gonna remove the dressing. I see that the site is no infiltration, no signs and symptoms of infection. If I have my roll tape, I think I'm gonna measure the lines to compare them from the last time, to see that they're not shorter or they're not longer, and then I'll go ahead. So I'm gonna clean my hand today, and then I want to set up my sterile field. Okay. And then I'm gonna grab my gloves. Okay, so I'm gonna pinch here. think some of these gloves are so old and they're stuck together. The gloves are stuck together. Okay, and then I think the gloves, because they've been there for so long, they kind of stuck together. So I apologize for that. All right, okay. All right, so I'm gonna grab. I already have my mask on because of the COVID, so I don't need a mask on anymore. I'm gonna put a mask on the patient. And Mrs. Jones, please turn your head to the other side so I can clean your face. I can clean your IV side. And then I'm gonna grab the alcohol and I'm gonna clean inside out in a circular motion from the closest to the outside. From the closest to the outside, I'm gonna clean. And then I'm gonna put it in the trash. And then I'm gonna grab and clean again. And also in a circular motion, I'm gonna lift up the lumens and clean underneath every corner. I'm gonna clean and make sure I get every area cleaned properly. And then I'm going to use the skin prep on it. Alrighty. So I'm just gonna wait for the skin prep to dry a little bit before I apply my dressing. All right. After doing that, I'm gonna now grab my normal saline and I'm gonna flush each of the lumen with the different normal saline. So I'm gonna flush for patency. I'm gonna flush the other one too I clean it first before I clean it. And I close it back up. I grab another one, I clean it with the alcohol prep, and then I flush again with another, this is only one I have, with another one, and then that is done. So after I've done that, I know that everything is, are you okay, Mrs. Jones? Make sure everything is patent. I make sure the site dressing is labeled. I label the time I did it, the time of the day, and then because so I'm going to just Mrs. Jones, do you have any pain? Do you have any concerns for today? Okay, so the dressing is done. I'm gonna put the head of the bed in a comfortable position. I put the bed back down in the comfortable position, and I'm gonna take off my sterile gloves, and then just put another gloves on. Remove the patient's mask, and then remove the trash, and just generally clean everywhere the site that I used. I'm gonna return all the equipment back to where I got it from, and I'm gonna go back, wash my hands. Then I come back and document everything I did and the patient's reaction in the EMR. And then, so Mrs. Jones, everything is done. Do you need anything? Okay. I'll make sure patient is comfortable, put the call light within reach, and then I'll be back in another 20 minutes. If you need anything, just call with the call light, okay? Thank you.